My name is Olazagasti. I'm a medical oncologist at the University of Miami, and I'm assistant professor. I specialize in thoracic malignancies and head and neck. And something that I feel extremely passionate about is in disparities of cancer care, particularly in racial and ethnic minorities, and with a special interest in Hispanics. When I got the invitation to talk about loss in translation, I felt like obviously proud, but at the same time very excited to be able to be given this platform to talk about the importance of language concordance, right? And how this can affect not only the report between like a physician and the patient and a team of oncologists, but also really like the overall cancer care diagnosis and overall outcomes. This is something that as a Latina physician living in the United States, in the mainland, I have experienced firsthand. And so I think it's something that's really, really important. And I really want to give the props to the ISSLC and World Long for really bringing this important topic into a session and not letting what's happening in our current world or our climate to really deter us from what's important, which is really equity and making sure that we do a good care of providing the best possible cancer care for our patients, because ultimately we really just do everything for them. And so I'm just really excited and I feel very honored to have been chosen for this talk. And not to say that this is really my first invitation to speak. I've been chair in past sessions, but this year is going to be the first time that I'm taking the podium as a speaker at World Long. So definitely an honor and excited to do that. World Long, it's my absolute favorite meeting of all. There's just something about this meeting that just really makes me feel like so eager and so comfortable. I don't know if it's a component of nostalgia because it was one of the first meetings that I attended in 2019 as an oncology fellow. And it's a meeting that I actually went to Barcelona. So it almost feels like really like a stepping stone going back there at that time where I was a fellow. I was really not sure about where my career was gonna take off. I wasn't sure what I wanted the next steps to go. If I wanted to be a community oncologist, and academia was not something that I was in sight yet at this time. And so I always talk how it's really a meeting that opened my doors and my eyes to a future of possibilities. It's where I met my now mentor and dear friend, Nargis Flores, and where really like I felt like I finally found someone that shares not only some of my values, but really my interest and my drive for cancer care and disparities. And so being able to meet her then and collaborate and kind of like see how this relationship has flourished and how she has become my sponsor and kind of like how I've been also growing in my own as now like an attending physician and being more like colleagues rather than mentor mentee relationship. It's been something that's really is has been so important to me in my career. And so just coming back to Barcelona and coming back to World Long is something that I always really have been looking forward to. World Long is a meeting to me that's very important because everything that you see is like thoracic oncology. You don't have to feel like overwhelmed trying to condense everything in. It's like anywhere that you look, it's something that will really benefit your day-to-day in clinic. And so to get to really just not only learn the science, but also see people continue to navigate relationships and network and I know how far this networking relationship have got me today, so I just cannot imagine, or I'm just excited to see what the future holds in the next like 5 to 10 years. And so it's really just encompasses everything, just like learning, just networking, friendships, community. And so it's just like a great place to be to just really continue my path as a thoracic oncologist and just see where just this life takes me. Sometimes, as a young junior oncologist, you compare yourself to other people, and you're always wishing that maybe that you're doing more and you're accomplishing more, and you feel like, am I on the right track? But I think it's important to also kind of like pause and kind of like take a breather and look at everything that you really have accomplished and look back and see how far you've come. So I think I just, as a word to other also like junior oncologists or people that really just like, I just can't wait to be on that podium or just like feel so hungry, right? To do so much and really achieve so much. I feel like it's possible. It's important to just be patient. Like nothing comes like at once, but you just like build up on it. And I think the ASSLC and then the World Lung Organization and community is really like a great place to be able to just propel your career in that way. They really open doors and try to like include diverse task force and faculty and make sure that they're including like female physicians and also from different backgrounds. And I think that's really important to be able to like just find your place and continue to strive to grow and develop into bigger and better things.